Hey everyone, I'm Jocko Sims. You might know me as Dr. Reynolds on the show New Amsterdam. You know, I've learned quite a bit playing a doctor. For example, I've learned that when someone is having a cardiac arrest, every minute counts, and survival depends on immediately receiving CPR. Did you know that 70% of cardiac arrests happen in homes? And with many of us spending more and more time at home these days, it's all the more important to know what to do in a cardiac emergency. Let me show you a technique that I learned from the American Heart Association. It's called hands-only CPR. It involves 2 easy steps that can save the life of someone you love. Here's how it goes. Hey guys. So if you see a teen or an adult collapsed and unresponsive, first call 911 or ask someone to. Second, you want to push hard and fast in the center of the chest. Now, you might be asking how hard and how fast. That's a good question. You want to go 2 inches deep and about as fast as an upbeat song like Staying Alive by the Bee Gees or Crazy in Love by Beyonce. Here we go. Now, the key is to keep your arms straight. You don't want to go bending your elbows like that, right? Here we go. Let's run through that one more time. If you see a teen or an adult collapsed and unresponsive, what's the first thing you do? That's right, call 911. Second, you push hard and fast in the middle of the chest, just like I showed you. Thank you, American Heart Association and Children's Hospital Los Angeles, for collaborating to bring this important message to the public. Remember, you could be the difference for someone you love.
Hello, everyone, and thank you for joining us today. My name is Jill McGlynn. I'm a Heart of NEPA volunteer and a supporter of the Saving Lives Through CPR Anytime campaign. So much important work has been done in our community by funds raised from campaigns just like this one and the many others offered through the American Heart Association. With your support, we can do even more. We ask that you consider making a pledge or even a gift by texting NEPA CPR to 41444 anytime during this program. Again, that's NEPA CPR to 41444. Our goal is to train 10,000 people and to raise $150,000. Now, we can only do this with your support and your help. So let's work together to continue bringing CPR anytime in the NEPA community. When we hear from our first special guest, you'll see firsthand how CPR has saved lives right here in our very own community. I'd like to extend a very warm welcome to Corey Glidden.
Thank you. Thank you so much for that introduction. So hello, I'm Corey. And my story begins when I was 13 years old, just about to go into 8th grade. Up until this point in my life, I was a very, very active person. I played basketball, softball since I was a little girl. And then also at this point, I had been running cross country. And my story starts on a day when, just like any other day, I was going to cross country practice. And I go out for a run with one of my very good friends at the time. And we are going up a very steep hill, pushing ourselves up. And I am yelling at her. I'm like, come on, let's go. We're going to keep going. We're not going to stop until we get to the very top of this hill. Meanwhile, she's behind me, lagging. And then all of a sudden, there was no noise. She couldn't hear me anymore. And she looked up and I had just dropped. I was just lying there dead. And that was it. Very fortunately, I was very close to a hospital and 2 people were able to come to the scene and administer CPR to me. And this was crucial because at this point I had been without oxygen for about 4 minutes. And after 4 minutes, the brain starts to deteriorate without oxygen. So they were able to go there, administer it to me. CPR probably is what kept me from having any brain damage, which is amazing and astonished all the doctors. until finally an ambulance got there and arrived me with one shock of the AED. So then about a week later, after staying in the hospital, we come to find out that I had a very rare heart birth defect called Alcapa, anomalous left coronary artery from the pulmonary artery, and I had open heart surgery to correct the situation. But CPR was unbelievably crucial that day for me, for my life moving forward, which now is also very active. I focus on bodybuilding now. I love the weight room. That's my thing. And then I focus on also keeping my cardiovascular up all the time, of course, hit workouts and things, anything to get my heart rate up. But yeah, CPR was very crucial that day. So I really hope that you all could learn something from my experience, from other experiences that you might hear, and take those 2 steps to learn CPR. Thank you.
Wow, Corey, thank you for sharing your story, how CPR helped save your life. Talk about hitting home. Incidents like this happen everywhere. Would you know how to best assist? Would you be prepared to provide hands-only compressions if needed? Well, the students from all around Northeast PA region are learning the 2 simple steps to hands-only CPR, just like you're going to learn in a little bit.
It is graduation season, and in Pennsylvania, that means more students making the grade to get their diplomas. Thanks to one of the Commonwealth's newer laws, high schools must teach CPR before seniors can graduate. Eyewitness News reporter Mark Hiller live for us in Wilkes-Barre tonight to explain. Mark?
Yeah, good evening. The American Heart Association has been behind this push to make hands-only CPR part of the school curriculum. Now the AHA and a local health system have partnered to help local students learn what could be a life-saving lesson.
This is the area right here that we have carved out.
The Show and Tell by American Heart Association of Northeastern Pennsylvania Executive Director Amy Skiba aims to groom the next generation of heart savers.
Ready? As hard, as fast as you can. Harder.
To the beat of the song Stayin' Alive, Sliba is teaching some Greater Nanticoke area high school students how to do hands-only CPR. The AHA recommends the no-breath, compression-only method if you encounter someone who suffered sudden cardiac arrest.
That right there will keep someone's blood flowing until EMS gets there, and it will most likely keep them alive.
Allied Services partnered with the American Heart Association to donate these kits, which include 10 inflatable mannequins, training DVDs, and other essential materials.
We're as focused as ever before about getting these training kits and supporting school districts in our region so that children do learn the importance of hands-only training to save lives.
The high schoolers training in this group are all student athletes.
In my arms and my wrist, I felt it the most.
And what were you feeling?
Like not really sharp pain, but like kind of like soreness after a while. I felt
it was hard, like trying to keep your breath, like you get out of breath really fast. But it's good to know because you could save lives with it.
The American Heart Association says 90% of sudden cardiac arrests suffered outside of a hospital end in death, most often because someone didn't learn what Mila Vanook just did.
It really taught me like where to place my hands on the body and like the timing and all that and when to really use this in life.
The more people that we have that are trained, that are able to do CPR, the better it will be for everybody.
The CPR in schools training kits cost $700. Allied Services donated several of them to some schools in Luzerne, Lackawanna, and Wyoming counties. Live tonight in Wilkes-Barre, Mark Hiller, 2822 Eyewitness News.
Mark, thanks. And head over to pahomepage.com to learn more about the CPR in schools training kits and about the difference between sudden cardiac arrest and a heart attack.
A very special thank you to the Nanticoke Central School District and to those students for participating in that TV segment. I'd also like to thank Jim Brogna and Allied Health Services for their support of the CPR in Schools program, as well as all of our CPR Anytime supporters and sponsors. To date, sponsors like these and like our next guests have donated critical funds so that these hands-only CPR kits can be distributed throughout our community. Let's continue with this life-saving work in the community by texting NEPA CPR to 41444 to donate. By learning CPR yourself and by getting our companies, businesses, and schools all involved. Now, let's practice with a demonstration from students and professors at the Passon School of Nursing at Wilkes University.
Hello, my name is Haley Farrell, and we are coming to you today from Wilkes University's Passon School of Nursing, where we will be demonstrating the technique of hands-only CPR for the American Heart Association NEPA campaign. With me today is Professor Joyce Victor, and we'll join her as she teaches a hands-only CPR class.
Recently published evidence demonstrates that hands-only CPR can be as effective as conventional CPR, that's CPR with breaths, when performed by bystanders. Therefore, the American Heart Association now recommends that hands-only CPR can be used by any bystander who witnesses an adult suffer a sudden collapse outside of the hospital setting. All you need to remember are 2 steps. Call 911 and compress hard and fast. You want to compress at a rate of 100 to 120 beats per minute. Ready?
Thank you for joining us, and we hope that you will participate in the Heart of NEPA campaign.
Thank you so much to Haley and her professors for that wonderful hands-only CPR demonstration. Now, let's see how knowing these skills can impact your life and the lives of those you love.
We were just sitting watching TV, and all of a sudden you threw your hand up in the air, and that's something you don't do. So I looked and said something's wrong, and I jumped up, and you were already blue. But you're on the couch, and I had just learned CPR, and they said they had to be on the hard ground, so I rolled you onto the floor, and so started calling 911 before I started the CPR, and then I did the CPR, but I thought it was a pretty lousy job I did. I guess it worked.
It worked. I heard one doctor said even if you hadn't seen me for a minute, if you'd been in the other room, and not seen me, my arm go up 1 minute, I would have been gone.
She was blue, and she really wasn't responding, but the dispatcher kept saying, keep doing it, keep doing it. It worked.
Just had my 72nd birthday last week, and just so grateful, and I thank God every day I'm alive.
Over the past years, there's so many things we've been able to do. You get to walk down on the beach and collect shells, and we ride the bikes.
Yeah, I appreciate life more, than you appreciate having me, right?
Oh yeah, yes ma'am. Things change very fast, that's for sure.
Yeah. And our priorities change, for sure.
Mm-hmm. Oh yeah. Now we get to take our grandchildren out and just having fun. Is all we're doing.
Yeah. It taught me that life changes on a dime, and you have to cherish every day because you just happen so fast. You are my life. You are my life. My husband is fine. I'm just so lucky.
What a sweet video. Who wouldn't want more time with their loved ones? Simply put, this is what CPR could mean to someone you love. Thank you to everyone who joined us today. Help us reach our goal and save more lives.